Psychologist and adjunct professor at California State University is back with us to try and talk about where we stand with all of this. So I want to get to the kids in a moment, Wendy, but first of all, there is this issue. They keep telling us not to touch our face, but it is really hard not to touch your face. You don't even realise you're doing it. So why is that? Because it happens a lot in stressful moments.
In fact, in two separate research studies, we touch our face apparently between 16 and 23 times per hour. Think of it this way. There are lots of nerve endings in our nose, our eyes, our mouth. It's how our sensory awareness is to the world. Also, we have tiny little hairs that keep particles from coming in, dangerous things in both our ears, our nose. Of course, we have eyelashes and eyebrows to prevent debris from entering our body. And so that debris can cause itch. And when we're told not to touch our face, we become even more aware of that itch. So we're touching more often.
Yeah, so do this with your hands because it gives you that moment to think about what you're doing with them before you react to something, I guess, anyway. Okay, let's talk about the kids and the parents having a lot of special quality time at home right now with the little ones. But this, especially with the kids, the younger ones, it can be quite terrifying. Your advice, and this is important, before dealing with their anxieties and their fears, manage your own feelings first. So explain why that is so important.
Because children have an emotional lifeline to their parents. And as a result, they're little sponges. And they absorb, no matter what you say, they absorb what you're feeling. So the best way to help calm a child is to calm yourself. Whether it's mindful meditation, whether it's some cognitive behavioral tricks to sort of reframe this as a positive, interesting new stage in life. And then you can get to the good work of explaining to kids what's going on in, simple language, not scary language. But isn't this an interesting science experiment happening in the world?
And kids are smart. They know when someone's sort of spinning a line at them and it's not being, when someone's not being genuine. The question of what to say to your kids, it came up during the coronavirus briefing at the White House on Monday. This is how President Trump answered the question.
I've spoken actually with my son. He says, "How bad is this?" It's bad. It's bad. But we're going to be hopefully a best case, not a worst case, and that's what we're working for.
I'm just wondering if parents should be maybe a little more reassuring than that. Explaining stuff like hand washing is really good way of stopping the virus. Empowering children as opposed to maybe just terrifying them.
Exactly. I mean, we can quell people's fears by giving them a sense of control, whether they're a kid or an adult. So what are we telling adults? Wear masks, wash your hands, wear gloves, etc. And with kids, we can reassure them with one other thing. Besides spending time teaching them about microscopic germs, we can also teach them that there are lots of scientists working very hard right now to quickly make a vaccine. Kids understand vaccines. They've been getting the vaccine since they were born. And so explaining to them that very soon, some amazing smart scientists are going to bring a vaccination to all of us and we'll all be safe again. And in the meantime, we'll just stay a little separate from each other to keep us safe.
Yeah, UNICEF points out it's important how you end the conversation. This is from their blog. As your conversation wraps up, try to gauge their level of anxiety by watching their body language, considering whether they're using their usual tone of voice and watching their breathing. So it's not just what children will say, because sometimes they don't have the words to express their feelings. It's the non-verbal language, which is sort of equally as important.
Of course, and even with adults, you're looking to see how stress, ignore the words, pay attention to the body language and what they're doing. If they're having sleep disruptions, if they're crawling into bed with you, this is okay. Reassure them, hold them close. They just need to be told that everything's going to be okay.
Yeah, you had some very good advice on what parents should be doing right now. Essentially, play games, be with the kids, don't worry about the tidying up, all that kind of thing. We're out of time, but there is some great advice. It's out there a lot on websites, but also from you as well. So we appreciate you being with us, Wendy. Thank you very much. Wendy Walsh for us in Los Angeles.